Hi, my name is Dr. Shawn Johnston. Today we're going to talk about poor posture. Poor posture is something that affects most of us, especially here in America. We are a flexion-dominant society. That means that we sit in a flexed position throughout most of our day. Most of us are either at a computer, either we are driving a lot, and even for our leisure we sit down and we watch TV. So this flexion-dominant society, or this poor posture, is something that we all suffer with. So what is poor posture? How can we define it? Well, there is a guy who defined it very well. His name is Yanda, and he's all the way over in the Czech Republic. And Yanda coined a phrase or a term for poor posture called upper cross syndrome. If you take a look at this photo, you will see what Yanda described as poor posture, and you'll see a pattern. There is inhibited or turned off back musculature. That mid-back is turned off and not used because it is stretched out. That front of the neck is in the same position. It is long and lengthened and turned off and not used. But on the other hand, you've got certain muscles like the chest or just under the skull, the muscles called the suboccipitals, that are on and very tight. So this cross, or this X that you can see on this picture, creates a syndrome called upper cross syndrome, and it creates a gambit of symptoms and problems. But today we're going to talk about 3 of them. We're going to talk about tension headaches, neck pain, and disc pain associated with it, and we're also going to talk about shoulder pain. So tension headaches. We just did a video on tension headaches, and we described how it is a very common headache to have. In fact, it is the most common headache out of the hundreds of different types. So, poor posture and tension headaches. How does this affect it? Well, you can see, if I turn to the side, you can see if I put my neck forward and I put my hands out like I'm on a keyboard, this position loads this portion of the neck. It loads what we call the suboccipitals, these little muscles right behind the skull. And those muscles, when they are tight or shortened, create this squeezing on the nerves of the head. So these nerves wrap around to the front of the head, and you'll get pain going into just above the eye and around the skull. So if you are sitting at a desk constantly, or if you're on the phone constantly, or watching TV constantly, if you are in a position where those suboccipitals, those little muscles, are tight and they squeeze those nerves, then you'll get that throbbing pain going to the front of your head. There's several things that you can do for tension headaches. One is take a tennis ball, take 2 tennis balls actually, and duct tape them. Take those 2 tennis balls that you've duct taped and lay on your back and put them right behind your head and put a little pressure on those suboccipitals. This is one very easy way to take care of those tension headaches. Another symptom that poor posture can cause is generalized neck pain or disc pain. If you take your fingers and you place it just here in the middle of your neck and you lean back, you'll feel a couple of vertebrae disappear. They move forward. This is C5 and C6. For those of you with neck pain and disc issues, this letter and numbers will ring true to you. Most people with disc pain have discs at C5 and C6. This is the most common place because it is the most movable joint in the neck. So, with too much movement in a joint, there's always going to be some problems. And if you are sitting in a position like we just got through talking about, in this flexed position, you can see here at C5, C6, where those vertebrae disappear, how they are constantly being in a position of stress. So if you're constantly stressing C5, C6, you are more likely than not, if you are not doing something to counteract that poor posture, you are wearing and tearing those joints. So you could get degeneration at those joints, and you could also get a disc bulge or disc herniation. You'll know if you have a disc herniation if you have a couple of these following symptoms. One is generalized neck stiffness. Another is shoulder pain. It'll feel like somebody punched you in the shoulder. And another symptom is to have pain right here, just at the base of the scapula. Those are three areas where you will generally have pain with C5, C6. You'll also have numbness and tingling going into the hand. For generalized neck pain, so this is saying that you don't have a disc, but you do have pain in the neck from this poor posture. A lot of people will carry their pain in their upper trapezius or their levator scapula. These muscles are notoriously known for causing pain in the neck. We all know that tendency to rub the neck here at the upper trapezius and the levator. We all feel that tension if we've been sitting down for too long. And you can see that if I'm in this position, how short and tight those muscles get here in the chest and up there at the upper trapezius. So if something is tight, it's on and it's painful. So that is generalized neck pain with disc. So what's something that you could do to improve that? Well, making sure that you stabilize the neck. Neck stability for a disc is crucial. So one easy exercise to do that we go over with all of our neck pain patients is to practice deep neck flexion. So it makes sense that if this is flexion, this is extension. We call it deep neck flexion. So I like to put my hand on my chin to just reiterate the fact of the direction that I'm going. So I get myself in good posture with my shoulders down and back and my rib cage down, and I bring my neck back and I hold it in that position. So bringing your neck back in this deep neck flexion is one easy exercise that you can do in your chair. You can do on the ride home from work. It's a very simple exercise to defeat disc pain. Shoulder pain. This is a very difficult topic to understand, but I think we'll be able to get it. So, poor posture and how it affects the shoulder. So if you take a look at this photo of the shoulder, you'll see a couple of mechanisms or a couple of bones that are working together. You'll see the scapula, the humerus, and the AC joint. Just underneath that AC joint, you'll see a muscle called the supraspinatus. It is notorious for rotator cuff syndrome. It's where most people will get their pain in their shoulder if they have a rotator cuff tear. So how does poor posture give you a rotator cuff tear? Well, I'd like to explain, so hang on and put on your thinking cap for just a second. So if we're sitting in this forward rolled position a lot, you can see that this shoulder is rolled forward almost like an 8 does. You know, you've got that forward rolled tight chest position. You'll also have an upper trapezius that is very tight. So this is where it gets difficult. But if you notice, the upper trap is attached to this bone called the scapula. And this scapula and arm move together. So imagine the picture that I just showed and that humerus. They move together in one fluid motion, and you have to have both. If you don't have both, this is what happens. The upper trap, this muscle that you shrug with, it's always so tight that you want to rub, pulls that scapula up. When it pulls that scapula up, it doesn't move. So it is unable to move as you reach up for things or you grab. So with the scapula not moving, that means the humerus is doing 100% of the work. And if it is doing 100% of the work, it means that it is closing down on that little spot, that little tunnel where the supraspinatus runs out. So here's a stretch for the shoulder. As you can see, my arm can come all the way down. Those of you with shoulder pain, your arm will not be able to go all the way down. In fact, your arm will probably be somewhere in this position because of the tightness. So here's how you get into position. Here's how you not get into position first though. If you bring your arm all the way out and you're not stacked, this is an orthopedic test for instability, and you can almost pop your shoulder out of place. So make sure that you do this right, that you tuck that shoulder deep in here, and that you want to imagine a pin being able to go down from shoulder to shoulder, staying stacked. I don't have a pillow, but you might want a pillow to be able to keep your head so it doesn't get tired in a flat position or a horizontal position. And then I want to put it like probably a shoulder, somebody with shoulder pain would be. If it's right here, this is a great stretch. You take your arm and you push back, but using your other hand to block. So push about 20% of your strength. So I'm pushing back this way, 20%, just using this right hand as a wall. So I push and I hold for about 8 seconds. I take a deep breath in, let it go. I push, about 8 seconds. I'm continuing to push, a deep breath in while I'm pushing, let it out, and let that go. I do that again. Do that about 3 or 4 times to where your arm can touch the table. If someone you know or even yourself is suffering from one of those 3 things, tension headaches, neck pain or disc pain, and shoulder pain, let us know. Give us a call at 565-4200. My name is Dr. Shawn Johnston at Relief Plus, and we would love to help you out.